more interesting for people to view.
You might think this is someone gaming, but it's far from that. She's a researcher in a lab working on a revolutionary way to help people with severe respiratory issues.
Are these anything interesting here? Are these injection points?
Using a VR headset and a handful of 3D printers, MUHC researcher Dr. Darcy Wagner and her team are on a mission to make lung transplants a thing of the past.
And then the syringe sits here.
They're 3D printing patches which fit over a patient's damaged lung tissue. The first step, creating specific inks that are compatible with lung tissue.
We really try to bring tissue specificity to what we are generating with that, and we hope that that's going to lead to better outcomes in terms of what we can generate, that it's closer to what lung or airway tissue is like in the body.
The research is in its infancy, but has already shown promise.
So we actually saw that when we transplanted that we had these cues that vessels from the eventual recipient, that they could actually grow into the grafts that we transplanted.
Wagner, who's also a mechanical engineer, says she was in Munich when the idea for the project came to her.
That we actually made a pretzel. I know it sounds pretty cheesy, but this was sort of like the aha moment that I really believed it was possible when we first found materials and a process that we could actually make something that looked like a complex object that otherwise would be very difficult to generate.
Worldwide, about 7,000 lung transplants are done each year. There's only one hospital in Quebec that can do the surgery. It's a complicated, precise procedure. And according to stats by Transplant Quebec, 14 people are currently on the wait list in this province alone.
Yeah, you ready? Okay.
Wagner, an American who was working in Sweden, was recruited by the MUHC as part of its push to propel innovation.
Recruiting people like Darcy to come and work at the MUHC is really, really important to ensure that our community has access to the latest and greatest and excellence in healthcare.
The research is far from human trial, but if eventually approved, could one day save many lives. Rachel Lau, CTV News.